Are West Highland White Terriers prone to hip dysplasia? Hip dysplasia is a condition commonly seen in dogs, particularly in certain breeds. This genetic disorder affects the hip joint, causing it to develop abnormally. One breed that often comes up in conversations about hip dysplasia is the West Highland White Terrier. In this article, we will explore whether Westies are prone to this condition and what steps can be taken to prevent or manage it. Firstly, it is important to understand what hip dysplasia is and how it affects dogs. Hip dysplasia is the result of a malformation of the ball and socket joint of the hip, causing instability and improper movement. Over time, this can lead to pain, lameness, and even arthritis. The severity of the condition can vary, and it can be more prevalent in certain breeds due to genetics. When it comes to West Highland White Terriers, there is mixed information regarding their predisposition to hip dysplasia. Some sources claim that Westies are indeed prone to this condition, while others suggest that they have a lower risk compared to other breeds. The truth is that there isn't a clear consensus within the scientific community. To better understand the risk of hip dysplasia in Westies, it is crucial to look at their breed history and genetics. West Highland White Terriers were originally bred in Scotland for hunting small game, and their strong, muscular bodies were essential for this purpose. However, their anatomy and genetics may not be entirely suited to optimal hip joint health. While it is true that Westies are generally considered a healthy breed with a relatively low incidence of hip dysplasia compared to larger breeds, it does not rule out the possibility of individual dogs developing the condition. Genetic predisposition is a complex issue, and it is important to remember that even within a breed, some dogs may be more at risk than others. If you are considering getting a West Highland White Terrier puppy, there are steps you can take to minimize the risk of hip dysplasia. Start by finding a reputable breeder who conducts proper health screenings for their breeding dogs. A responsible breeder will test for hip dysplasia and only breed dogs that have passed the screening process. This helps ensure that the puppies have a lower risk of developing the condition. Additionally, proper nutrition and exercise play a vital role in maintaining healthy joints. Providing a balanced diet and avoiding excessive weight gain can help prevent extra stress on the hip joints. Regular exercise, such as daily walks and moderate play, can also promote muscle strength and joint stability. It is important to note that while preventive measures can reduce the risk of hip dysplasia, they do not guarantee that a Westie will never develop the condition. Some cases may still occur despite the best efforts of both breeders and owners. If you already have a West Highland White Terrier and suspect that they may be showing symptoms of hip dysplasia, it is crucial to consult with a veterinarian. A professional examination, often including X-rays, can determine whether the dog has hip dysplasia and to what extent. Early detection is key to managing the condition proactively and providing appropriate treatment options. Treatment options for hip dysplasia in dogs can vary depending on the severity of the condition. More mild cases may be managed through conservative measures such as weight management, physical therapy, and anti-inflammatory medications. For more severe cases, surgical intervention may be necessary to correct the abnormal hip joint structure or provide pain relief. In conclusion, while West Highland White Terriers are generally considered a breed with a lower risk of hip dysplasia, it is not completely ruled out. Genetic predisposition and individual variation within the breed can still result in some dogs developing the condition. Responsible breeding practices, proper nutrition, regular exercise, and regular veterinary checkups are essential for minimizing the risk and managing hip dysplasia in Westies. Remember, early detection and intervention can greatly improve the quality of life for a dog with hip dysplasia.